Hello, I'm Dr. Brad Watkins. Thank you for visiting Synchrony Health Chicago. So, laparoscopic adjustable gastric banding. It's been FDA approved in the United States since 2001. It's the only adjustable weight loss operation. We've done thousands of these operations. We've been doing it for almost 8 years now. We've published 5 papers on gastric banding. We've had thousands of successful patients, and it basically is an adjustable ring that goes around the upper stomach with an adjusting port that's attached under the skin. So it's very easy to adjust it as an office procedure. And basically you have a small stomach above the band so that you're full on a small amount of food, you're full for a long time, and easily losing weight. It takes away the dieting mentality, and it creates a healthy, natural weight loss. Gastric band surgery is an outpatient procedure. It takes less than an hour to do the surgery. It's done under a general anesthetic. There are 5 small incisions. We use a lot of numbing medicine to minimize pain after the surgery. We do a lot to minimize nausea after the surgery. We do everything we can to minimize scarring with the tiny incisions. And basically you're in the recovery room for about an hour and sitting in a recliner for about an hour, and then you go home, and we'll call you later that night to check on you and see how you're doing, and we'll see you in the office a week later, and the first adjustment is done after 4 weeks of healing. Most patients are back to normal activity within a week. After the band surgery, you will get very full on a small amount of food. You'll eat slower, you'll have to chew things more carefully, but you'll get full, and you'll stay full for a long time. We see lots of patients that go from eating a large meal and then they're hungry a couple of hours later to getting really full on a small meal and staying full for a long time, and that's a very powerful weight loss tool. Comparing the risk of gastric band surgery to the risk of gastric bypass surgery is like comparing a fender bender to an airplane crash. The implications are incredibly different. There really is no comparison. All surgeries have risks, no question. It's just a much lower risk operation. There's no cutting or rearranging of the intestines, there's no stapling. We're simply placing an adjustable band around the natural stomach and attaching the port to the muscle lining. So it's a very low risk operation. There's no such thing as zero risk surgery, but it's a very low risk surgery. So the band adjustments, the first one is after 4 weeks of healing, and then on average patients will get 3 to 6 adjustments in the first year. It varies quite a bit, which is a marvelous part of the operation. We can customize it for every patient. So some patients get more, some patients get less, but generally every month or so we adjust the band until you reach your goal weight, and then there's very little adjusting that needs to be done. It's interesting that as you lose weight, the stomach inside the band loses weight. So to maintain the same degree of restriction, we have to tighten it as you lose weight. So the adjustments are a very simple procedure. You come in the office, we have you stretch out on the exam table. We can feel the port through the skin. We access the port with a specialized needle. Most patients say that it's less uncomfortable than an IV stick, say for blood work. And we add saline to tighten it and remove saline to loosen it. And the actual procedure takes seconds, and it's as simple as that. So the weight loss after gastric band surgery is a natural, healthy weight loss. So you're going to lose about 1 to 2 pounds a week. Some patients lose more than that, but a good, healthy, fat-burning weight loss is about 1 to 2 pounds a week. So the nice thing is it's a healthy, natural weight loss. You're not losing muscle, you're not losing bone, you're not losing hair, teeth. You're just losing fat. It's a good, fat-burning weight loss. You're losing weight because you're full and you're not hungry. The most rewarding thing for me is the patients are amazing. They do amazing things. It's amazing to help somebody lose over 100 pounds. It's amazing to help people get rid of diabetes and high blood pressure and sleep apnea and high cholesterol and depression and joint pain. We see patients that are able to stop 11 medicines. We see patients that save $300 a month on medications. We see patients that used to ride motorcycles and they can't anymore and they lose the weight and they ride motorcycles again. We see patients that grew up riding horses and they can't ride horses when they're overweight and they start riding horses again. So every day a patient comes in the office and there's some new thing that they're doing in their life that's amazing, and they're crying and we're crying, and it's just an amazing way to spend your professional life. If you're considering band surgery, my advice would be to come in and talk to us. Meet the people in the office. Everyone that works in the office has had the gastric band surgery. Come sit down in the office with me and let's talk about band surgery. Some patients are thinking about it and they just want to talk about it and they're not ready for surgery yet, and you need to know that that's fine. We're more than happy. We don't do high pressure sales. We love helping patients. You may not be ready for it, but come in and talk to us. Come in and hear the stories of the patients that work there. Come in and get all your questions answered, and just know that you don't have to have surgery. We're not going to push you into surgery, but come and let's talk about it and see if it's right for you.